Hello, everyone, and thank you for joining me wherever you may be. My name is Christopher Chavis, and I am the Director of the Policy Center here at the National Indian Health Board. And in this video, we will be doing a very broad overview of some of the litigation that has happened around the CMS vaccine mandate. We'll be discussing kind of the impacts that will have. I will give you this caveat before we dive in, however. This will be a very quick, very broad overview of these cases. I won't be getting a lot into some of the more nuanced arguments that were made and that were expressed in the injunctions that will be discussed. But this will be more of a broad overview to kind of help familiarize you all with this case. As I'll say at the end, I'm happy to answer any follow-up questions that may come as a result of this video. So before we dive into the substance of the matter, just want to give you all some background information regarding the mandate and regarding what has happened to get us to this point. So on November 5th, CMS, the Centers for Medicare and Medicaid Services, issued an interim final rule calling for a vaccine mandate for most Medicare and Medicaid providers. And there has been some confusion around what exactly that means for Indian country. But I wanted to go ahead and put that out there. On November 29th, however, the District Court in the Eastern District of Missouri issued an injunction against the enforcement of this mandate in 10 states. And just a day later, the District Court in the Western District of Louisiana issued a national injunction, pretty much halting the enforcement of this nationally. So again, you might imagine this is a pretty sweeping mandate, and litigation will start pretty quickly, as it did. And obviously, both of these decisions will likely be appealed upward and will make its way up through the federal court system. But this is where we stand as of right now. So what did the courts consider before issuing the injunction? So first of all, I think most fundamentally, they assess the impact of the mandate, right? What impact is this going to have on providers? And both courts voiced a concern about the mandate's impact on rural communities, right? And I think we're obviously very familiar with this in Indian country, and much of Indian country is rural. They voiced concern around provider shortages. And there was a fair amount of discussion around the fact that even without a vaccine mandate, folks can post a position, it sits vacant for, in some cases, years before it finally gets filled. And both courts kind of looked at that fact and thought about and contemplated, well, if there's now a vaccine mandate, which would in theory shrink the pool of folks who could apply for these positions and serve in these positions, what might that do to the broader provider makeup? And they say that CMS failed to consider this, right? And the Eastern District of Missouri even went a step further, and they cited specific examples of what could happen as a result of this mandate. So just as an example, they discussed one rural hospital where the only anesthesiologist was going to quit because of the vaccine mandate, and they, stated obviously this would pretty much halt surgeries in that hospital, and obviously that would broaden access to care gaps. So, in a lot of the conclusions that the courts came to, they did assess the impact to rural communities. And then I think in Indian country, that's something I think is particularly important, for us to keep in mind, considering obviously both the rural nature of Indian country and the provider shortages that Indian healthcare providers are facing. So one of the things they looked at too was the question of, was this a proper exercise of the Secretary's authority? And this came up in a couple of the different analyses that were done. And one of the things they spoke about, both courts did, was the requirement that Congress must speak clearly on the authority to promulgate rules that have vast economic and political significance. So, set this aside and look at this independently. A national vaccine mandate, does that have vast economic and political significance? The courts thought that it did, and they thought that this rule met that threshold. And that Congress, if Congress indeed intended for CMS to have this authority, then it should have spoken clearly on that in a previous statute. And they felt that the Secretary of HHS, which oversees the Centers for Medicare and Medicaid Services, overstepped his authority to promulgate such a rule. So this kind of comes up again in the next thing I'm going to talk about here as well. They focus a lot on the novelty of the mandate. And very fortunately, we have not needed a national vaccine mandate. What we're experiencing right now is frankly, once in a century pandemic. In our lifetimes, we have not seen anything of this magnitude. So there's going to be a lot of novel things that come out of the pandemic. The Eastern District of Missouri, though, in their analysis, looked at the fact that vaccine mandates have historically been the purview of the states. The states have usually issued them, and the states have usually enforced them. And they cite, case precedent that would lead one to conclude that. And they felt that the federal government was overstepping its authority and altering the balance of power between states and the federal government. And this is, I think, compelling when looking at arguments of tribal sovereignty. I think that the idea that of there being reserved powers that the states would have, that reserved powers that the tribes would have, and the ability of the federal government to come in and to kind of dictate things and change things around. I think that's something worth thinking about here, because there is kind of a parallel argument that may exist for tribes here as well. And I guess I do want to point out this other parallel here is the courts point out that this kind of shift requires explicit congressional authority. And again, I think that this kind of parallels a plenary power doctrine, where Congress has plenary power over tribes, and Congress can kind of again make laws that impact tribal nations. So this argument here, and it was persuasive to the court, was that Congress should have explicitly authorized something of this magnitude that would kind of alter the balance of power between the feds and the states. And again, there are some parallel arguments that can be made on the tribal side as well. So again, just wanted to go ahead and put this out there. They also discussed notice and comment, and so procedurally, what happened with this was it was an interim final rule that was issued. There's a comment period, but the rule was into effect before the comment period. That is A, unusual, and B, in order to do that, you have to have a good cause exemption. However, this is incredibly rare. This doesn't happen very often. And again, as I said earlier, once in a century pandemic, there's going to be a lot of rare things going on. And you can, and obviously that was an argument put forth by CMS in this instance, right? This is a unprecedented pandemic. We need to be able to act quickly. However, the court wasn't persuaded by this. They did not find there was a good cause exemption. One of the things they cited to was the fact that this was announced 2 months ago, and they felt that in the 2 months between the issuing of the rule and the announcement, that would have been time to do notice and comment. And again, the parallel argument from the Indian country perspective would be the need for tribal consultation, and to make sure that the rule is crafted in a way that respects the sovereignty of tribal nations and the unique nature of the Indian healthcare system. So again, wanted to point this out here as well. The court was not persuaded that there was a good cause to bypass the notice and comment period. And I will just point out that there were instances during the height of the pandemic last year where waivers were issued and state plan amendments were approved where tribal consultation was put off, and there wasn't really, at least in the waiver side, your traditional notice and comment period. So, this is something that we've seen in the past, but in this instance, the court was not persuaded that it was warranted. Finally, I want to talk about whether or not the rule is arbitrary and capricious. According to the Administrative Procedures Act, if a rule is arbitrary and capricious, it must be set aside. And the Eastern District of Missouri kind of, in their analysis, they talk about the wideness of the rule and the fact that it applies to so many providers. And they talk about how CMS only used data from a couple of provider types and extrapolated that out to the whole. They did not feel this was proper. And in their eyes, they felt that this contributed to it being arbitrary and capricious. It's also discussed that CMS didn't consider other alternatives, such as testing or natural immunity from a previous infection in terms of deciding whether or not that should be considered in conjunction with the vaccine. The courts were not persuaded by the argument that the vaccine is the best way to protect against infection. So again, there was that discussion of were lesser, lesser restrictive alternatives considered. Courts found that that did not happen. They also discussed the fact that President Biden was initially against the vaccine mandates, going back to his time as a candidate, and that he had reversed course on this in just the last couple of months. Again, there are arguments that it was warranted. The administration was concerned about low vaccine uptake through voluntary channels. Obviously, the administration was concerned about a winter surge, particularly in conjunction with other viruses such as the flu virus. But the courts did not find that very persuasive. They found it was arbitrary and capricious, and those so they are setting it aside. Now, this is the end of the presentation. I will say what comes next. The injunctions were given because the courts felt that the folks who are anti-mandate had a high likelihood of success on the merits of their case. This will be appealed. It will continue to go up the ladder. We'll continue monitoring this, and we'll provide you with any updates that we have as this works its way through the court system. I want to thank you all for taking the time to watch this video. I hope it was helpful for your purposes. And as always, please reach out to me if you have any questions. Thank you for joining me, and I hope you have a great rest of your day.